There, Debbie, welcome. You've come in on a link. It's a real shame that you couldn't make it on the train to be in the studio.
I'm really sorry. I was looking forward actually to a sunny trip on the train, but I was told that because of the train strikes and the overtime bans, no trains were guaranteed, and that many platforms, even though it said the train was coming, it never showed up. So apologies. But sometime soon I'll be with you in the studio, I promise. But isn't hindsight a wonderful thing? Because with the recent news, obviously, of AstraZeneca being withdrawn, we were all looked upon 4 years ago as conspiracy theorists. And sadly, we have been proven right. We weren't conspiracy theorists at all. And I wonder sometimes when we look back if some of the people responsible, their words will come back to haunt them, because we're not going to forget. Are we? We're never going to forget. And that's why I want to highlight two, but actually three women in particular. Now, the BBC reported that in the birthday honours in 2021, the COVID vaccine heroes were recognised by the Queen. You can see there that you've got Kate Bingham in red, Dame Kate Bingham, and you've got Dame Sarah Gilbert in blue. I probably should have put Dame June Rain in there as well, because I just want to highlight that Dame Sarah Gilbert made AstraZeneca. Dame June Rain approved AstraZeneca. And Dame Kate Bingham was responsible for choosing it, procuring it, and distributing it. So in my opinion, those three women were responsible for every single AstraZeneca injury and death in the United Kingdom. And certainly Kate Bingham and June Rain were responsible for the rollout of every single vaccine in the UK. So I want to start off with Dame Kate Bingham today, but I just want to let you know that Dame Kate Bingham, she has a master's in biochemistry from Oxford. She's also got a master's in business studies from Harvard. And because of that, she got an honorary doctorate from Imperial. So this is an honorary doctorate, and she's been working closely with pharmaceutical companies. Now, back in 2022, she gave a lecture along with Dame June Rain, actually, at Somerville. It was called the Somerville Spring Meeting, 5th of March 2022, entitled From Wartime to Peacetime. She was followed on immediately after by Dame June Rain. So I want to show you a little bit of video. I'm beginning to wonder whether Dame Kate Bingham thought that she was in her front room talking to her friends, or whether she'd ever realised that we would come to see what she said 2 years ago. Let's have a listen. Kate Bingham.
I ended up with an email on April Fool's Day inviting me to join this expert group, and to which my reaction was, well, I'm not a vaccine expert, Patrick. Why on earth are you asking me? And the answer was, what he wanted was somebody with that expertise and knowledge of the small company landscape, because that's actually where the innovation comes from, even if it's ultimately the pharmaceutical companies that deliver and distribute.
So April Fool's Day, she got an email from Patrick Vallance. She wasn't really qualified in anything to do with vaccines. So if we go and look at uk.gov and see the announcement of her appointment, you might note there it says that her job was to enable a task force to accelerate the development, that's a very important word, the development of a safe and effective vaccine. It goes on, she goes on to say, if you just skip to the next slide there, that she's worked in the biotech sector for a very long time. Sorry, could you just go back a slide? That's it. So she's uniquely qualified for the role and worked in the biotech sector, but she's most recently managing partner for SV Health Investor. So her work has led to the launch of 6 drugs for the treatments of patients with inflammatory and autoimmune disease. So if you just skip to the next slide, we can see that Sir Patrick Vallance said that it's vital that the UK continues to play its leading role in trialling potential vaccines and stands ready to get behind any viable vaccine candidate. This word trialing is extremely important. So let's look at a little bit more about Kate Bingham. So we can see that she is managing partner of SV Health Investment. That's a leading international life sciences venture capital firm. So she's a venture capitalist. We can also see that she's heading up the UK's Dementia Discovery Fund. We'll come on to that a little bit more. But that was set up by all the pharmaceutical companies, so no conflicts of interest there then, and the Department of Health. If you skip on just one more slide again, you can see there we have got her company, SV. Sorry, I can't read it there. Health Investors, investing in tomorrow's healthcare breakthroughs. So let's see what they actually deal with. What do they deal with? Well, they deal with therapeutics, dementia, healthcare, growth, and med tech. So this is the company that she's involved in. If we go to see her on the board, we can make sure, just verify everybody, please go back and check all of this out yourself. On the Dementia Discovery Fund, there she is, Dame Kate Bingham. But who funds the Dementia Discovery Fund, I wonder? So I've just drawn a few arrows to show you a few, just a few of them. And you can see that we've got the Gates Foundation, Bill Gates, we've got AstraZeneca, we've got Pfizer, we've got the Department of Health, we've got GlaxoSmithKline. I mean, you know, the conflicts of interest are enormous. But that's not all, because she's also a board member of the Francis Crick Institute. So there you go. She's an honorary board member of the Francis Crick Institute. But I want you to have another little look at her performance at the lecture at Somerville, because we're coming up to another video. And well, how would you chair a government meeting, do you think? It's a serious business, chairing a government meeting. And who do you think navigated or helped navigate her way through government to get her conditions met? Have a listen.
And so during the third meeting I attended, I got a text from Matt Hancock. And I was actually trying to do two meetings at the same time because I had a clash with one of my portfolio companies. So I had two screens up, which is of course not how you're supposed to do meetings, but anyway, I did. And he texted me and said, "Can we speak?" And I said, "No, you're supposed to be joining this meeting anyway, and it's a government, vaccine meeting." So anyway, we spoke afterwards, and he said, "Would you chair the Vaccine Taskforce? We're going to create a dedicated body." To which I sort of virtually fell off the chair because I hadn't thought on earth why was he calling me. And I asked for 24 hours to think about it because I gave him all the reasons why I couldn't do it. And then eventually he said to me, "Kate, look, none of us have done this before. We're asking you to step up." And that was a little hard not to take that seriously. And when I questioned him on what authority was he inviting me, he said he'd just come back from the Prime Minister. So I asked for 24 hours. I am very lucky to be married to the most amazing husband, Jesse Norman, who then was Financial Secretary of the Treasury. So obviously he actually spent £1 billion doing furlough and all the self-employed funding. But he absolutely helped me navigate through government and Whitehall and Parliament and everything. And so the following day, we went back with Jesse's clear advice, with a list of conditions saying I would do it, but only subject to these terms. So the terms were, it was reporting to the Prime Minister, it was a 6-month term, I could recruit who I wanted, and the government would put in place a very streamlined decision-making process. And then, because I was convinced that government always leaks everything, my final condition was that I got to sign off on all comms. But it didn't really make any difference, that one. But all the other ones did make a difference.
Woman that gets her own way, eh? Set down the conditions, navigated by her husband, who was in charge of £1 billion furlough. Very nice, don't you think? Not. So let's look at her husband, Jesse Norman, because he was indeed a minister, an MP and minister, but he resigned from the government last November to focus on local issues. But according to Wiki, he is also a member of the Privy Council. So he has got high roles. And of course, there you've got the confirmation that he is married to Kate Bingham. So let's find out a little bit more about Kate Bingham, because a little article from Welt gave a little bit more of an insight into who she was. The article was actually entitled "Former UK Vaccines Chief Says Yes to Russian Jab If Data is Good." Well, to be honest with you, she'd say yes to any jab if she could get it in the arms of the British. But if you look at the, there's an interesting article actually, but there's loads of questions. This is the first one. Are the Brits more happy to take a risk? Well, actually, yes, because they're willing to pay upfront when they've got absolutely no clue whether anything's going to be safe or whether it's going to be whether it's going to work. When asked about the speed of authorization, she was very quick to praise the MHRA, and let's not forget she was followed on in the lecture by June Rain. One of the other questions she was asked about was indemnity, and she revealed then that actually it wasn't a choice and that the vaccine companies had the government by the throat, and they basically said, if you don't give us indemnity, we won't give you the vaccine. So the government are reported to have felt very uncomfortable. So we'll end on one short video, but what I can say is we're going to be showing, if you think the videos that we've shown just now are shocking, we have far more to show you in extra, particularly hairy, scary. That's the clue. But let's just finish on this one video from Kate Bingham in her performance at Somerville.
I knew that if any one of these vaccines worked, we will have picked the best ones in that, because we had a real kick-ass team that did the work properly. But I didn't know if any one would work. I mean, the much bigger concern was, might they all fail? And one of the things I'd persuaded the government to do, which they, again, were really ballsy to do, was they were willing to put money up front before we knew whether or not any of these vaccines would work. Because if we waited to figure out whether or not the vaccines were both safe and effective before we started scaling up and manufacturing, it would be another year before we got the vaccines. So we had to start investing in manufacturing scale up as soon as we decided we were going to prioritise those vaccines and support the clinical development. But if those vaccines failed, all that money would be wasted. So we ended up spending 900 million sterling in upfront spending, all of which could have been lost in order to buy what was, whatever this is, 357 million doses.
So if they'd have waited for health and for safety and efficacy data, they would have waited another year. So they didn't bother. I rest my case.
Debbie, thank you very much. So much I could say about that. But of course, what she said to camera was that she wasn't qualified and the team was put together in a rush. And then later she describes it as a, quote, kick-ass team, which did a good job, but it wasn't qualified to do a good job. She wasn't qualified to do a good job. And now we've got people who are damaged as a result of these vaccines. It's truly astonishing. Ben, I better bring you in on screen because I could talk about that one for quite a lot longer.